Welcome back. Glad you're still with us. And for those of us who are joining us here in the audience, the conversation today is on World Cancer Day. And like we said, across the globe, nations are marking this very important day and just driving the conversation on cancer because like we said, we talk about cancer every single day. And we're coming to you from Meru County. And to be specific, we're coming to you from, I want to read Meru Methodist Hospital. I was about to say something else. Professor would have kicked me out. Meru Methodist Hospital right here in Meru County. And today we're having a conversation because like we said, when we started this conversation probably more than an hour ago, and we said there was a research that was done, I think around 2019 thereabout, and they said Meru County is actually a hotbed for cancers. So the bigger question is then what ought to be done as soon as now so that we either reduce the cases, and especially when it comes to the new cases, or just completely, prevent cancers. And we have a panelist joining us this morning. We have Dr. Gethu Wachira, who's a medical officer of Health Igembe South. We cannot talk about cancer in Meru and not have, someone representing us from the county. So Dr. Gethu, it's so good to see you. Karibu sana to the discussion. I hope you were following a bit on your way here. Fantastic. Okay. So we were talking about the burden and the trends that, have been seen over time. But what is that cut thing that we need to unmask when it comes to cancers right here in Meru? We've talked about so many other things, but what is it from where you sit, that probably you would attribute it to or needs to be really unmasked so that we understand where the problem is?
Thank you very much. Yes. My name is Dr. Gethu Wachira. I am the Medical Officer of Health for Igembe South. I am also a member of the Meru Methodist Hospital Board and a close friend and partner of this hospital. So as you've rightly pointed out, the burden of cancer in Meru is actually very high. I think that cannot be overemphasized. And right here in Igembe South, where we sit, we have our cancer registry in Meru that has actually shown us that we have quite a high number of incidences in Meru County, and particularly in this Igembe South. Now, there has been a big question everybody has been asking that, what exactly is causing this? And I know all of us are all curious, how do we answer this? And I think we have come up with all kinds of theories. But the thing is, we do not yet know exactly why it is that we have these high incidences of cases within coming from Meru County. However, a lot of effort is being put towards that. There is a partnership between the county government of Meru and the Kenya Medical Research Institute to try and answer these. And actually, that is who have set the registry that you're talking about, trying to figure out why Meru, and why these very high numbers.
Yeah, right now. And let us know a bit on the numbers and what the numbers look like. And like they say, data does not lie. But how concerned are you with just that statement that up until now, we don't know what exactly is the issue? So how concerned are you? Because now if we don't know, how are we able to prevent or, cut it from the bud, the major cause for the same?
Yes, maybe to correct that, we do not know, but at least we may have a clue, from, what you know about science and the cancers that cause these. And that's why we are concerned with the whole spectrum of care for cancer, starting from we start from, prevention, early detection, early diagnosis, treatment, then after treatment, palliation. So we are at that point of, prevention and early detection. We do know some of the risk factors to the commonest cancers that we have around, and we are working towards, identifying that and doing a lot of civic education along those, risk factors that we have identified for the most common cancer cases within Meru County.
I see that. So we were taking questions, so probably let's just finish that round and then come answer, those, and then we'll answer now the question of what ought, to be done right here in Meru County, but also just tying that to the theme, for this year as well. And Prof, we were to talk about healthcare financing as well, so maybe we'll touch on that as well. But very quickly, just to your questions, where do we have the mic? Okay, so Let's finish with this side and then we'll come back to this side. Okay. All right. So whoever has the mic, please stand and start with your name and let us know what question you have or if you have a comment.
I am Robert Cheriot, a final year nursing student here at Methodist College of Health Sciences, Maua. I have to share, and has it in any way affected the accessibility of chemotherapy and radiotherapy for cancer patients? And if yes, how? Thank you.
All right, very nice. Hey, it's good precedence, short and straight to the point. Dr. Griffin, think that is more for you, or George? You will let us know who wants to answer that. All right, let's take one more from this side or two. So who has the mic? Yes, please stand, state your name and who you're directing your question to.
I'm Enoch, senior student. Actually, I've not been informed, but you have a very nice college here for nurses, so I'm from there.
Oh, thank you.
Yeah, you're welcome, you're welcome.
In case we didn't know.
So, my concern today is about our cancer warrior have talked about stigma. Stigma is a key thing. We're talking about poor seeking behaviors, late visit to the hospital. But what are we doing about it? First of all, when I'm stigmatized, me myself, I'll be like, I'm not going for it since I would be set aside. We need psychological support for these people, for them to show that willingness. For the panel here, would like you to generate a team. Let us mobilize, inject the society whereby we can treat this thing. Okay, the team may be there, but we need to empower it. Let it be functional, effective. To understand that, I know I can get it. I won't be stigmatized. Maybe my friends who sent me aside. If they do, I have some people I can rely on. This thing happened when there was the high cases of HIV. Stigma was the main thing to solve the thing. So what are we doing about it? Let us mobilize the society. I'll be encouraged if I know I have people who will support me. Despite financially, maybe financial is a problem, but stigma is a key aspect in health. If I don't have the support, I would be coming. Why? I come, I lose my friends, I lose my job. What for? Eventually I'll die. But let's make them understand. You'll get treatment, we'll get company, we'll get you a job. And with this, I think these cases may be done. Thank you.
Fantastic, thank you. Asked the question and answered it. But thank you for that. And also Agnes, probably you'll chime more into that, right? In terms of fighting stigma and also the role of warriors, in helping people, in talking to people about it. Okay, do you have anybody else from this side who has the mic? Okay, all right. Oh, there's a hand here. There's a hand here in front. Okay, yeah, so after her, we'll bring the mic to you. Okay.
Good morning.
Good morning. Afternoon, actually.
Afternoon. My name is Kendi Gwantai, a community student here. My question is about the radioactive waves that are buried underground. Then the late Cyrus Jirongo also talked about it, the late President Moi, but he was silenced. So I'm asking the panel, what are you going to tell the victims that are being affected by the radioactives, and what do you think the government should do about the radioactive waves? And also my other question is about the iron sheets. There's a belief that is going around saying that there are some iron sheets that are causing cancer. Is it true? And if it's true, how do you think that the people around should react to it? And if it's false, then the claim should be the belief should be, yeah.
Okay, I see. Thank you. Very good question. Thank you very much. All right, let's bring the mic here. Yes, tumpige makofi. Thank you. All right. Yes, please stand and state your name and the question and who you're directing your question to.
Thank you. My name is Janet Munene, Nursing Services Manager, Maua Methodist Hospital. My question goes to Dr. Wachira and then Dr. representing Texas Cancer, and maybe even our doctor here, Dr. Omonde. In 1980s, Dr. Wachira, we used to have, as much as we are saying that the patient come late, these days, I think we have maybe lost in direction. I don't know. I need to be guided. Reason being in 1980s, 80s, 90s, we used to have a primary health care, very intensive. But these days, I don't know what happened because I have grown to see ourselves going out for outreach to teach mothers, to teach school children, to assess them, to do cervical cancer screening. But I don't think we are really doing that, though it is being done, not like what I used to see before. Because even if we are saying that we have a lot of cancer, we can still arrest if we go back to the direction we had it that long time. My fellow nurses, we also need to concentrate a lot in assessing our mothers who are coming for antenatal clinic, who are coming to deliver in maternity, whom we are seeing in the outreach clinics, if any, so that if we identify there is a problem early, sincerely, this mother can be helped or this person can be helped, though maybe there are some cancers that you cannot be able to diagnose early. But when it comes to breast cancer, when it comes to cervical cancer, we need to do a lot. We have a lot as health workers that we need to do. We educate our community, we educate the mothers, we educate. And by doing that, we are going to help our people. Thank you.
Very nice, thank you. Appreciate that. Can we answer those and then we transition to the other side? Okay, do you want to go first, George?
Yes, I want to go first. The rest, my panelists will answer. I want to begin with my sister here. Yeah, about the primary healthcare system that was very robust during the early 90s. I can confirm that it is very robust even today. Last week, Texas Cancer Center, together in partnership with National Cancer Institute and the Ministry of Health, were in Kirinyaga the whole week doing cancer screening. And we found so many precancerous lesions last week, and we were treating them on the spot with ablation, especially for the cervical cancer. That I confirmed was done, and the positive cases for breast cancers were referred immediately. This week, I think they are in Nandi and West Pokot. I think it's being run for the entire country, but they're doing it based in terms of the counties. So that's something that is ongoing, and the teams are all over doing the test and treat approach. So that is already ongoing. I think they'll come to Meru as well. Yeah. And James Kahinga, and may the two souls rest in peace. He lost his brother and mother-in-law to cancer. And us as a cancer team, we say sorry for that. Now, I want to answer his question in terms of diagnosis with a hypothetical example. Forgive me that. If I look at the second row from where James Kahinga sits, they are human beings seated there, right? You know, when I look at them from the back, I want to know whether they are human, whether they are ladies or men. Is that true? Assuming I was looking at you from the curtain, I see they are human beings seated in second row. That is how cancer behaves. I have to take a sample from that team to confirm they are ladies, right? So in any diagnosis for cancer, you have to do a biopsy. You cannot treat cancer without a biopsy. So that is how we diagnose cancer. And healthcare workers and doctors that are here present, James talked so categorical about his brother was managed on gastritis, I guess, with antacids and PPIs for long. Please, if you treated these people with antacids for long, PPIs, maybe Kate's, H. pylori, and is continuing to coming to you. After one kit, second kit, you even order another third kit in Nairobi. I'm told they even order them from somewhere. This is a case that you need to study further. I am one of the team who I don't recognize H. pylori test as a test for H. pylori. So for me, I would recognize endoscopy. So for these patients who you treat them with H. pylori kits, with PPIs, and they're not going away, with history of smoking, alcoholism, plus a family history of cancer in the family, so many risk factors that associate with that, please do endoscopy. Thank you.
Thank you. Thank you so much, George. Do you want to go next? And then we'll come to you, Dr. Griffiths.
Thank you very much. Thank you very much, Sister Janet, for rightly pointing out the role of primary health care. And I would like to confirm, like my colleague has said, that I think everybody agreed that primary health care is very, very important. If you're to deal with cancers and non-communicable diseases, if we are to reverse that, we must start from the ground. So yes, I would confirm that we have a very robust, it's even better, the primary healthcare system. And for those that may be aware, earlier on, the government passed 3 acts. I think immediately this government came into place. One was called the Primary Healthcare Act. There was the FIF Act, and then there was also the Digital Health Act. So all those acts were trying to consolidate, the health, looking at the health system, and to actually strengthen that primary care network. So the population has really grown from what it was in the 1980s, and so the models that worked in the 1980s may not necessarily work. So currently, we have what are called the primary care networks. So as Professor rightly pointed out, our governor is very keen on our health system, and points out that we don't have a private patient, a faith-based patient, or a public patient. So all these institutions exist to meet a need. And so Maua Methodist Hospital is also part of those primary healthcare networks. So in summary, or in short, how that works. So we have at the community level, we have the households. And for Meru, for example, at least in Meru, every single household is mapped to a community health volunteer. So those community health volunteers are attached to facilities. So if these community health volunteers can be able to reach every single household, and with that, we can be able to pass messages to the community, and at the same time, the community can be able to reach out to these people for, simple screening. They have basic training on basic screening, and then there is a referral network from the community to the lower level facilities, all the way to the level 5 facilities. Secondly, somebody else asked about the question of SHA and chemotherapy patients. I know we are not politicians. There has been a lot of politics about SHA and all those things. But maybe what I would like to explain to our people is this, that at least for the county government that we work for all our public institutions, if you are registered with SHA, you get all the services without having to co-pay. Our Meru level 5 hospital has it has 2 oncologists, it has a cancer center, and SHA caters for all those bills in that cancer center. SHA also caters for cost in the primary care facilities. If you came to Nyambene Hospital and you are registered with SHA, you will get all those screening services. There's a package under SHA for that. So SHA may have its weaknesses and its challenges that I think need to be worked on. But credit to that, that has all been thought out. Although those packages need a bit of improvement, but that's a debate for another day. Thank you.
I see that. I'm also keen to hear from Prof. SHA. Maua Methodist Hospital is there, is it not? Just a little bit on that, and then we'll come to Agnes.
Thank you very much. Actually, for us, as Dr. says here, there could be myths and claims and blames, but actually here we are 98% sure. Our major problem is the delay in payments, and that is a claim everywhere. Even when you go to check or everywhere else, that is even to the president. That has been our claim, that SHA is in all these hospitals. Like us now, if we lose SHA, we'll lose the hospital because we are 98% of SHA. And the question that my only problem is about payments, actually, the delays and sometimes not rationalizing even the payment. Because you may find somebody having over 100 million paid 5M or 2M. This is a mini claim. So if SHA and the authorities can correct that fact, that will be the best system, so to speak. Yeah.
I see that. Thank you so much, Prof. Agnes, do you want to touch on stigma and how do you fight it from your perspective as a warrior, and also speak on what role you play and other warriors can play to really help fight cases of stigma? Very quickly, because our time is really far much spent.
Okay. What I can talk about treatment and the care and the emotion is that once somebody has been diagnosed having cancer, a process from the diagnosis to the treatment is taking long. Maybe my question can go to oncologist who is here and who works in Texas. Texas 30 process is not long like in our county. When you are diagnosed in our Meru hospital level 5, there is cancer center there, it will take you more than even 3 months before you start chemo. And that time, the disease is progressing. Because today you don't come for counseling, come with a relative, come next week, come next month. Maybe you started when you were in stage 2. Before you start, in fact, I'm saying some reaches stage 4 before you get the treatment. There is a lot of delay. What are we going to do? That delay affects most of the people. Some, they even stop going to the clinic because I've come 1 month, 2 months, no treatment. Why should I come? Let me go and die at home because I have no money to go to Texas or KU or other places. So our hospital, level 5, male is ours, but there is a lot of delay from diagnosis to the treatment.
I see. And probably, Dr. Griffin, you can couple that with maybe a question that you're answering about asbestos. And Prof was like, yes, we are dealing with that here at the hospital. Very quickly, because our time is far much spent. Yeah.
Okay, thank you. Thank you so much. Let me just start from her concern, then I could say something I wanted to say. The process takes long. Remember, I said, if all oncologists in Kenya sit down to see all cancer patients 24 hours a day, they can't still see all cancer patients in Kenya because of the stretch we have on personnel and on also services. If you get there, the process, there could be a perceived delay, yes, but you will not find the clinic having no people and you will not find it empty as well. That would mean that as there is delay, the place is still full. Maybe the need for expansion. There are conversations to level 6. Probably Dr. Githu may be able to talk about it more. But the greatest thing is still about the stretch on resources, because there is actually, you get there, you will find it continuously busy as others actually wait for that. The last thing, also, there was a perspective we were arguing who will answer about SHA. In my opinion, the truth of the matter, apart from delayed payments, the model of SHA is better than NHIF, in my opinion. In terms of accessibility, in terms of how things do, I think it is better than NHIF. May not be perceived because a few outpatient visits could not be available for people as they want, but if the model is adhered to and implemented rightly, it is way better than NHIF. And like Prof said, if we eliminate SHA here, if we are surviving, it means SHA can survive. We only need a few tweaks here and there to ensure that it survives. Okay. So basically, that is what I wanted to say about it. Yeah.
Okay. Thank you so much. I know there's a question on asbestos. Probably
yes.
You can touch that with your parting shot, because we literally we need to share 3 minutes there. All of with your parting shot, as far as then answering the question on what next. And I'm so sorry, guys, we cannot answer your questions, but hey, we're going off air, but we'll still be here to answer those questions, right? But what next? And especially for Meru County, in like 10 seconds, if you can, all of us, and then we'll have, a vote of thanks from, the HR manager right here at the hospital. But very quickly, in like 10 seconds. What next?
What next? We can't treat what we have not mapped. We can't map what we don't know, and we can't come seeking for care if we don't know. Let us educate our people. Let us educate our people. Let us educate our people. Yes.
Thank you so much, George.
Thank you. Today is 4th of February. Is a Cancer Awareness Day. The whole world is celebrating the cancer warriors. And together, let us end cancer stigma. Let's enhance awareness. And also let us also promote prevention and screening. Thank you.
Fantastic. Thank you so much, George. Prof, allow me to jump you. Wewe ni host utatufungia kikao and hear from Dr. Gethu.
Yes, thank you. So as we mark World Cancer Day, I think an assurance from the county government of Meru, one of the greatest priorities in the governor's agenda is the cancer, the whole spectrum of care. And it's excellent that we are seated here, at least talking about it. It's a great stride towards it. Let's keep the conversation going and let's strengthen the partnerships. Thank you.
Fantastic. Thank you so much, Agnes.
Mine is support. Please support those who are sick. Pray with them. They are not infectious. They are your sisters and brothers. They are your people. And those who have not been screened, please take time and be screened because you don't know yourself. And it is not done once, it is done maybe even every year so that you can at least know yourself.
Thank you so much. Tupige makofi. Very well said. Cancer is not contagious. And Professor, what will be your message as far as what next, and especially what next for Maua Methodist Hospital?
What next for Maua Methodist Hospital? What next for all of us who have attended this forum? I may answer in an anthropological way. We have talked about culture, trying to curtail the training or the awareness. I'm thinking now it's a matter of fact that we apply to our people to teach what we call encapsulation and even acculturation. So people understand clearly why cancer is there. Cancer is not from, you are not bewitched, you are not this. For that reason, we come enlightened, informed. Number two, I think it's high time we increase services on oncology. Because even when we say oncology, people ask, people so people didn't know what oncology is, and therefore you cannot give what you don't have. So we need to train our people to understand the cancer and its intricacies.
Fantastic.
The third one and the last one.
Yes.
And this is the last one. It's an appeal to our government to add more oncologists. You heard our doctor talking here, there are few. Even if we say to consult the oncologists, where are they? So we appeal to the government also to increase the number of these. Because without some people who are well informed, we'll continue crying the song of cancer. And they finally invite you to our unit even when you are not sick to understand more about cancer.
Thank you. Thank you so much, Professor. Wapigie makofi. Fantastic panel that we had this morning. Asanteni sana for your time. And I also want to say a special thank you as well to you guys for being such an amazing audience. To mjipigie makofi. And before we say goodbye, let me introduce Franklin Muchuri, who's the HR manager from Maua Methodist Hospital, to give us a vote of thanks. Tumpigie makofi as he stands.
Thank you very much for this session. So I have two humble duties. My name is Franklin Mutwiri, the Human Resource Manager, Maua Methodist Hospital. And I would like us to recognize our partners who have made this event a success. So you will allow me mention them the standard way, then I shall conclude with a vote of thanks. So we have William Gitonga Solution Circle, Alfred Mudharimi Solution Circle, Samuel Kiremi Solution Sacco, Silas Mwangi Demetrica Limited, Pius Kobia, Jamii Yetu Sacco, George Obunyo, Texas Cancer Center. We have Stanley Mungadhia, Jamii Yetu Sacco, and we have Dr. Mutugi and Tomorithi Chak. We have Robert Mwema Family Bank Manager, Tony Budi, SCC, HSFP, IGC. We have Mugambi Gitonga Nyambene Arimi Sacco, James Mativu, KCB, Maua Branch, among other partners that we have on board. I will also wish to appreciate our board members who are in the house. The hospital, Maua Methodist Hospital board members, they can stand and wave in a second. Thank you very much. So, thank you very much. I will go ahead with my vote of thanks. And I am truly honored to deliver this vote of thanks as we commemorate World Cancer Day under the powerful theme, United by Unique. So today's conversation has powerfully reminded us that while every cancer journey is deeply personal and unique, our response must be united, intentional, and collaborative. I wish to sincerely thank our distinguished panelists who have taken us through this session, our health care professionals, researchers, policymakers, and partners, whose tireless efforts continue to strengthen cancer prevention, early detection, treatment, and patient support across Kenya and beyond. Special appreciation goes to NTV for hosting this important national conversation and for bringing cancer awareness into millions of homes across the country. Allow me to especially appreciate the Maua Methodist Hospital management, led by our CEO, Professor John Mungania, and the Vice Chairman of the board, Reverend Bishop Kinoti Anampio, for their visionary leadership and establishing an oncology unit at our facility, which is almost done. Considering that our catchment area is among the most affected by cancer, this initiative is timely, impactful, and a true demonstration of commitment to saving lives. We also welcome partners to help us even have a larger cancer center in Maua Methodist Hospital. We have started it small to address the immediate issue that we're having, but we are welcoming our partners, especially from the national government, county government, to help us in this effort of ensuring that our people don't go up or don't get the hassle of traveling to far distances looking for these services. To all our partners, sponsors, organizers, and participants, your support clearly affirms that the fight against cancer is a shared responsibility. As we live here today, may we remember that behind every statistic is a person, a family, and a story, each truly unique, yet united in hope. Thank you all, and may we continue standing united by unique in the fight against cancer. Thank you, and have a blessed afternoon.
Fantastic. Thank you so much, Franklin. And ladies and gentlemen, that is where we put a close, on the forum today as far as marking the World Cancer Day. So we celebrate each and every one of you who's seated here, and to our special panelists. And of course, special thanks to you, Professor, for hosting us today. Remember, the theme is, and the theme goes up until 2027, United by Unique, Places People at the Center of Care and their stories at the heart of the conversation. So let's keep the conversation going. My name is Winnie Lubembe, on behalf of an amazing, amazing team who is behind me, who ensured that this broadcast was a success. We say thank you, God bless, and enjoy the rest of your viewing. Goodbye for now.